Okay, guys, we're online. So, hi everybody. My name is Anshruta, and I am the Scora RA for Asia Pacific. And today we're gonna have a discussion on a really fun topic and something that has intrigued everybody for the past few years. That is SRHR in a humanitarian crisis. Likes the fundamental things which normally are provided to people are something that are taken away. So that's the first thing that people need, like basic resources such as food, shelter, clothing. So initially the situation is bad. People are just trying to survive, but after a point when they are being set up where they're in a process of being rehabilitated, the resources are provided by government, international organizations, etc. However, statistics have found consistently that even during such phases, women and girls are at a much greater disadvantage and at a much greater risk. Um, they have to face issues in getting different sorts of violence. They are dependent on their male counterparts. In the absence of such male counterparts, they are often looked over to uh, get in touch with other families. And thus, in such cases, such women often find themselves in difficult situations, are sexually, physically exploited. And statistics also show that child marriage in such a region increases because, as women are considered a commodity, marrying them off makes the family more strong and helps them establish links with other families. So, with keeping all these notions in mind, we have with us today two very special people. We have Rujan, who is the Nora for SMSA Syria, and we have our beloved Scora director, Carlos, who's going to talk about the situation in Colombia. So, Lujan, do you want to tell us about stuff in Syria?
Yes, actually. Hello, everyone. Well, we might, most of us know what's happening in Syria right now. There's a war, a devastating war that is taking out the rights, not only the sexual and reproductive rights away from the people, but also the right to have the proper medical education or the proper medical care. So it's really bad in regarding sexual and reproductive health because um, even if there was cases that are diagnosed or have been uh, treated or rehabilitated, uh, they're now really ignored in all the conflicts happening, and most cities in Syria are now uh, don't have access to proper health care. So actually, it's too bad that we really don't know what's the reality of sexual and reproductive health now because it's all lost in the war. But we can say as medical students, there have been a lot of action towards awareness, whether about HIV and AIDS or other STDs. Um, like many groups of medical students have been trying to make awareness campaigns in girls' schools, in high schools in Damascus, as far as I know, and I don't know about other cities, but I think Damascus is the only city that is having a really like some people are trying to do something. Other than that, like for reproductive health issues, we've been lastly working on a policy regarding obstetric violence. So regarding Syria, it's a bit bad, not regarding only the war, but even before that. Ever since the obstetric hospital, the university hospital in Damascus has been uh, initiated. Uh, there hasn't been any like guidelines for treating pregnant patients uh, or even doing the right like like medical care for the basics for medical care for pregnant patients. So a lot suffer from consequences of bad medical care or insufficient like uh, infrastructure for hospitals. Um,
Yeah. Jean, Sudhi, put yourself on mute.
okay, okay, okay. Sure, can you go on? I'll be back soon. I have something urgent to do.
Okay, sure. Carlos, can you tell us some the situation in Colombia?
Yeah, sure. Okay, so hi everyone. Good morning. Good morning for me. So as you all know, the humanitarian setting in Colombia has been very different from the one in Syria. Basically, because well, it is a much chronicle situation, which is one of the main characteristics of this humanitarian setting, and because it is much more related, let's say, to a social cultural process that has been in a established in Colombia since the 40s. So as you all know, Colombia had the oldest, at least, guerrilla in the world, or a non-governmental armed group, um, which was called the FARC, the Revolutionary Armed Forces of Colombia. And in this political and social context, there was definitely the creation, kind of like of a second country within Colombia, in the forest, in the deep Amazon, where basically other city with other currency, other things, uh, other, I don't know, other lives occurred. um, so within this context, you're developing another type of society, you're developing another type of social rules, and when you change those social determinants of health, your sexual reproductive health also changes. Um, Not necessarily for good or for bad. I think in that moment, or in this type of organization, um, let's say, the supply, in terms of supply, in terms of having things, or trying to buy the necessary health kit, let's say, it was there, let's say, because the revolutionary armed groups did have enough funds, to provide healthcare in certain way. But then the debate was more in, okay, why are we, or how are we discussing universal health coverage, or how are we discussing healthcare for the women, girls, and people in general within this context, within the war. So this was, let's say, one of the main concerns of the feminist groups, and of the sexual and reproductive health panorama within Colombia in the past years. So as you know, Colombia just signed a treaty, a peace treaty with the FARC, which actually held, or I mean, this peace treaty was the main channel for the president to win the Nobel Peace Prize. And during the process of negotiation, there was also, let's say, an executive board of women trying to give input about how women and girls have suffered mainly from the conflict at whole. Um, the massacres were always huge, from like the ones that FARC did over these 45 years of war. Um, and they did have, let's say, the characteristic of having girls and women as a target, within the conflict as a, because, well, in our culture and, well, in many cultures as well, women represent like fertility, and the image of women represent kind of like fertility, kind of like steadiness, or like it is a stable figure, within a population, especially within countryside populations where a few other types of, let's say, um information or education is available. So in the countryside, still in Colombia, there's not this discussion of gender roles, etc. So the women figure still maintains a very traditional kind of culture, very traditional kind of image, and therefore it was generally a target for women and girls to be, let's say, involved within the conflict, or I'll be very more, how do I say this, more direct, for them to be killed within the massacres created, etc. So we have two panoramas: the one as the victim, the one that actually women and girls were kind of like the main target, not only for killings, but as well for the working afterwards. For example, they were generally the ones enrolled in making the life for the army, after the territory they lived in was captured. In, I don't know how to say that. It's not captured, but I mean colonized, more or less. And then we have the second setting in, okay, how can we make women part of the resolution with the peace treaty coming out? So that was another like insight of the conflict. Um so as I told you, it's not necessarily a war or a context of lack of supply as Syria can be. It is more or less kind of like the political will and political participation of women within the conflict itself. Um,
Carlos, I don't mean to interrupt, but first of all, I'm back. And secondly, there's something else I didn't mention. It's not only a lack of supply in Syria. Okay, there are places where families are displaced and out of their houses. So that includes women and girls. And um, I don't know if I can talk about all the things that might happen to women and girls uh, in conflict areas, because you can just find it online, and it's really heartbreaking. But also the community, the part of the Syrian community that's out of the real war, like for example the city center of Damascus and many other cities, Latakia, part of Aleppo, Homs. Um, there are places in Syria where people are living normally, like relatively normally. So what I want to talk about is here in this context about these groups of people living like a relatively normal life. There have been a lot of community work regarding them, uh, despite that they're not living like inside the conflict. They're not under the fire or something, but they're suffering psychologically from the war. They're suffering financially, um, and in many other concepts. They need awareness, and they need like care to stay like stay. as a community to maintain the basics that any community needs to get out of any war. Like, so there have been a lot of action actually in this context. And regarding sexual and reproductive health, there's something that's widely known in Arab countries in general, which is the stigma about something called sexual awareness. Like, people don't like this word, they don't like uh, listening about it. And in addition to that, there are groups of people that when you tell them, like, we need sexual awareness or we need sexual education, they might say that it's not something like necessary, it's not a priority right now. Um, and also it stands in the way of our values and our religious beliefs, or even not religious actually, a lot of like something they're raised upon, like, we don't talk about these things. Actually, this makes it worse even. Um, And what we're trying to do at Scora Syria uh, is not to force it into the community, not just to go to people and tell them, you have to listen to us, we have something to say. Do is change the concept that people see, when change the ideas that comes to mind when citizens hears that they need to get proper sexual education. All they think about is the things that might be said to them that that they don't agree to. Like, when we talk about safe, for example, safe sex or contraceptives or anything regarding that. So what we will do is, like, try to tell them that it's more simple than that. We only need people to know what it means to be a female or a male, what it means to be a girl, what would happen when you go into when you change from a girl to a woman. These kind of basics that everyone must know or everyone must learn at school, like, about the human body and how is a sexual transmitted disease, how it is transmitted, like what happens. Most people think that if you get in touch with a with someone living with HIV, like, you will get it. So so we will try to start from zero, like from below zero. That's what we aim to do, and it's really hard, even though, like, compared to what you guys have been talking about, it's really nothing what we are going to do. But in Syria, we hope that it might just break the ice and let people just get familiar with the idea of talking about it and not having to feel like uncomfortable or inappropriate.
Mhm. Yeah, I think you touched like two very important points. The first one is kind of like the stigma, surrounding the whole discussion of sexual and reproductive health, within the humanitarian setting, because so many people are worried kind of like out the and the political outcome most of the time, that we generally also like kind of like forget to battle stigma like along the way, and that is very common, like in other humanitarian settings. Like we kind of like fail, I don't know, to see beyond kind of like the current context that is giving aid, which is, yeah, which is necessary and okay, but then how do we solve the problems or like the health needs from the root, right? If not discussing social determinants of health, like stigma, and those kinds of things. I just wanted to add because you really raised like a very good point as well within contraception, which has been also really discussed within humanitarian settings, because when we talk about sexual and reproductive health and the right, the ability to choose, you know, how many children do you want to have, etc. In that way, you're kind of like I don't know, like within this context, you of course allow people to have kids within any type of context, being humanitarian setting or not humanitarian setting. Um, though within a humanitarian setting, as we were discussing, it's kind of hard to not only find supply but also find the social support, you know, to or either like start a family or have kids, or you know, like all of these services needed are not guaranteed or are not there in many cases. So then how do we stand as doctors, you know, in terms of contraception? Like, should we strive for it? Should we not orient the patients, you know, like how to build up this thing within the humanitarian setting? So in Colombia there was like this whole discussion, I remember when I was growing up, about having sterilization for the people, like within the context. And it was of course very polemic because it means kind of like not only the denial, let's say, of sexual and reproductive health within a humanitarian setting, but also kind of like a perpetuation of the conflict for many people. Like that symbolizes that symbolize a perpetuation of the conflict, because you're going to take out, let's say, because of the conflict, you're going to take fertility from someone, and therefore that person will never ever be able to have children or have etc. Because of the conflict, because the reason you did it was because the conflict was there and because it was hard and because etc. So that was also an interesting point, let's say, to discuss within the humanitarian setting, is whether contraception should be well, it should be available, of course, but oriented is kind of like another discussion that has gone really deep now. And the second point that you raised that was very important, it is okay. So how, um, in at least in this humanitarian setting, medical students were kind of like very active. So in the difference, like between awareness and not or campaigns, you know, within a humanitarian setting or not, is that, well, you are dealing, you know, in a battlefield. You are, let's say, having as a medical student a direct involvement with this issue, you know, physically even, and therefore you can have definitely actions, but then we need to be very kind of careful of what we're doing or what we are trying to raise awareness of, and the way we're doing it, because there are a lot of sensitive people, I mean, within the conflict as it own. Yes, you want
Actually,
you want to add something?
when uh, when launching Scora at Syria, it's kind of a challenge. Like whenever someone hears that there will be a standing committee for sexual and reproductive health, uh, the, anyone who would like hear that there will be a Scora, uh, he would be one of three types of people. Um, that's a challenge of ours. So the three types of people. The first one is someone, when you tell him about Scora, he says that, wow, we have such a thing. I'm totally in, and just get me in. I'll be in all the activities. I'm so interested in this. I want to tell people that they have to get sexual and reproductive health awareness, and we have to do something, and etc. The second person might say that, uh, oh, you have Scora, so you're probably gonna bring something from out of our culture, out of our beliefs, and just squeeze it in our minds. So I don't want there to be a Skora or a Sensa. I don't believe this is really what we need as Syrian people. So he would just get out, or might even try to prevent us from doing anything. The third type of people would just ignore it all, and it's the worst thing to do, actually. And we don't only want the second and the third type of people uh, to be resolved. We also want the first part to know that when you want to be accepted in a conservative community, you have to start from where they need. So that's basically um, our action like plan. So I don't know if it's possible. We haven't started yet. We're only in the planning phase, but I really hope that we can really do something. We are community oriented. We are conservative. Like we're not like out of the families we have been raised in, but also we can't just stand still and not have a score, since all the other committees are starting together. So why not score based way? That's what we're aiming to do, and I hope we can do it like in the most beneficial way.
I'm sure you guys are doing a great job already, and I'm sure you're going to have an amazing impact on society. And starting Skora in a conservative country is a difficult job, and coming from one myself, I completely understand your situation. And I hope and I know that you will be very good in what you do, and you will bring that kind of awareness that is needed for Skora in Syria. Carlos, you were saying something?
Yeah. I just wanted to give a little bit more, let's say, moving into another subject. It is, of course, displacement, and migration, which is very important to speak about within humanitarian settings, because it
Mm-hmm.
is generally one of the, kind of like solutions that we try to give. So um right now, of course, the world is talking about Syria, and refugees, within the European Union as a whole. And I just wanted to like relate that also happened with Colombia in the decade of the 90s, like late 80s and early 90s, because many Colombians were like migrating outside of the country, either to the United States or to Spain. And that's why it's like today you find a really like large amount of Colombian people like within Spain and well, US. Well, but now we have Trump, so I don't know if we're going to all get kicked out. So I just wanted to bring a little bit more of that type of experience, because when we are facing we cannot talk of humanitarian crisis without talking about these also like other factors that affect definitely the development of sexual and reproductive health within other countries, such as like the overlaid stigma that people suffer because of being a refugee, or because of being people from outside, like the country, migrants. So just for that, like, of course, refugees and migrants suffer like not only a shortage in access to healthcare, but also suffer other types of stigma that overlap with the stigma that you already carry from your own country. So for women is even more like uh evident, let's say, the effects on mental health mainly, and that reflect on their sexual and reproductive health as well. And there are many ways of gender-based violence that are maintained, and not only maintained but now intensified with other types of discrimination, such as racism and discrimination because of religion causes, etc. I let's say it is very important that we also speak about the availability of health for women in these contexts. I'm reading like I prepared to say some information for you guys. So the UNHCR estimates that amongst the arriving, let's say, refugees to the EU, about 20% currently are women. So generally, women are not, let's say, the great part of are a minority, amongst refugees. Although they are the ones who suffer the most consequences from the whole displacement issue. And they have, of course, out of this task, they only receive 40% of the total healthcare coverage that they should be receiving, which is also kind of, let's say, evident that we need to invest not only more awareness, but only more resources as well. So in the whole global humanitarian perspective, only 10% of funding will go effectively for healthcare. Out of the 40% of resources that go to women, only 10% of those resources are for healthcare. And specifically as well, in other types of disasters, let's say, that is also very important to speak about. The post-development framework of the UNDP had this, let's say, pamphlets. I just wanted to read some for you. So women are 4 times more likely to die in natural disasters than their male counterparts. Women and girls also suffer more from the shortages of food and economic resources in the aftermath of disasters or humanitarian settings. And this is also kind of like just bringing up a little bit more about the evidence and why we need to make more awareness of this topic and why are we actually doing this webinar today. Um, because also women are important for the, let's say, the aftermath of the whole crisis. They produce 60 to 80% of the food in developing countries while owning less than 2% of the land. Um, and the economic and educational gains associated with access to SRHR will help equip women with the necessary knowledge and skills to own property, more effective manage resources, and these are skills that definitely we need within a humanitarian setting. So the post workup of discussing gender-based violence is also relevant, and gender inequity is also relevant for the aftermath of a health crisis. Um, so also as well, women and children specifically are most exposed, let's say, to general toxics after let's say after I like how do I say this, like not a humanitarian crisis, but after a bomb, or let's say a certain conflict has occurred, they are most exposed to the toxins, if it like in the air or the pollution that was created. And this is also something that causes, of course, more chronic respiratory diseases and cardiac disease as well. So just bringing a little bit more about the facts of that, we do not only need to take care about like what is going on, what the news tells us, but the part of the resolution, as I was telling, in Colombia, where they're inviting women to the table, in order to have more equitable process of the peace treaty or of the peace process, but also as well taking care of the aftermath consequences in mental health, in um, the distribution of the budget, the political participation of women, and of course, like the health promotion. Um, I don't
Carlos,
know,
I would
Lucian,
like to
if you wanted
discuss
to.
one topic
Yeah,
with
sure,
you.
sure.
Basically, in most countries, including mine, menstrual hygiene products are considered a luxury. And in any sort of humanitarian crisis, such products are absolutely not offered to women without considering the fact of the repercussions that they would have on women's health and the hygiene and health of the family as a whole. And this issue was recently brought to light when the Venezuela crisis happened, and there were multiple articles that spoke about how women could not afford to buy menstrual hygiene products, and that is when there was a massive debate that sparked that discussed about access to such products during an emergency. So often, even as health consultants or as doctors, people on field look at the external injuries, they look at providing medicine for the people. However, in none of the documentation or none of the care kits that are provided are menstrual hygiene products provided, which basically we all know as medical students that poor menstrual hygiene leads to a number of infections. In severe cases, it may also lead to infertility. It can lead basically it leads to anemias, which massively in my country 3 out of 4 women are diagnosed with anemia, and a major cause for it is poor menstrual hygiene. So, in such a scenario, it is really important to discuss menstrual hygiene and advocate for it and not present it as a luxury, because these are basics that help in ensuring the health of a woman, and not addressing it is equivalent to denying it to her.
Mm-hmm. Yeah, definitely. You're totally right. I know like it's kind of like the discussion has uh is very pertinent, and catches fire. Let's say it like that. When we try to, because of course, like if you talk to not a healthcare provider but an aid provider, about like, okay, like stop eating food and let's just give tampons, like he would probably say like, what the hell are you doing, you're going against the thing. For them it's really not a priority, so that's what we need to do, when speaking with, advocating, and speaking with national NGOs. We need to definitely set the stage that, okay, like the medical evidence reasons for this is not only having the tampon, but also what the tampon means. The tampon means it is a cry for women's rights within a humanitarian setting. It is a cry for uh health rights, within a humanitarian setting. It is a cry for I don't know, like really advocating for the people, like the social burst of the people, and that is something that is not negotiable, for us, at least from the medical perspective. That is something that we should always advocate for. And people sometimes don't do that even. Sometimes don't, like, just simply forget that there's a whole other life out there. And also, of course, as I was telling you, the discussion about contraception, that it's very pertinent with also with this part, with menstrual hygiene, and vaginal hygiene, which is very important for maternal health issues as well.
Yes, really, thank you so much, guys, for addressing this thing. And regarding this, I have to say that I don't know, but in my opinion, this sort of uh, like culture that needs to be addressed in a community needs support, needs like governmental support. Uh, like in Syria, there's something called the Syrian Family Planning Association. It has been widely active in many communities. It has raised a really wide audience since just because it's a government-based like society or association. It kind of gets the acceptability it needs to really have access to the community and talk about gender-based violence or family planning. They even provide like contraceptive tools for in certain places. Also, a lot of other like associations or global movements, like for example, the UNFPA conducts research about these topics. So what I'm trying to say here that uh, everything that we may do uh, just stays in a really narrow concept unless it really gets support uh, from any like anyone who the people just really trust. So we need to get to those key people or key governments that might really convince people that it is necessary. And without it, I don't believe that we really would be able to make true movements or really valuable things just to say that we have done something that made a difference in the community or in the country. So I don't know what you think.
No, yeah, definitely. I think, well, we also like well, something that we missed, speaking about, was actually like the role of men in all of this, like and also teaching boys and men how to support women, and not only how to support women, but to involve them more in family planning and in um being part of the solution instead of just being an article, like a cone standing in the corner. um because that's what generally happens, like within, like for men it's not that it's much easier, just the resources given right now are more focused, or are developed in such a way that they are preferring, let's say, or not preferring, but they're easier, let's say, for them to be developed with men. And so we need to discuss and how to make that more accessible to women as well. um yeah, definitely there is many things, to speak about later. So well, not later, but further, and we would like to invite all square angels in the world to start speaking about this context. Just as a side note as well, I just forgot to mention something. Within a humanitarian setting, since there are not enough, I don't know how that works in Syria. I'm quite curious actually to have that. But in Colombia, midwives played a very important role, for example, within maternal health in Colombia, because midwives are generally, people that are come from the community, and that are generally very, very available, like for people. For example, you don't need to go to a hospital in order to contact a midwife in Colombia, at least. You just because they really act, at primary healthcare settings, like directly with the population, directly with the mothers, and they were very actually useful for the red canguro, which is kind of like the Ministry of Health program for maternity. That really they were really used when the crisis exploded back in the early 90s. And using, these social tools that already exist is also an advantage. So it's not only about let's say discussing intersectionality, multidisciplinary, settings, or multidisciplinary strategies, but also including, like those concepts of society that we have. So in many indigenous cultures in Colombia that were suffering from the crisis, sorry, it's very early in the morning. My English is terrible. That was yeah, like it's pertinent, to use these other types of people and, I don't know, organizations or strategies present.
Yes, actually, regarding Syria, midwives really play a big role, but unfortunately, they're basically in rural places, in the suburbs of every city or every every province in Syria. But right now, due to the crisis, there isn't anymore any rural places like all the villages or all these simple communities are displaced. So women are left alone. As refugees, whether in other cities, like that they're displaced and they go to the cities because they don't have anywhere else to go. The lucky ones get out of the country and try to, the privilege they go through to find a safe place to live. There are in Syria, inside Syria, there are 3 million women and girls of reproductive age, like from 15 to 49. And there are 500,000 pregnant women. Okay? Um, 1 million refugee women and girls are of reproductive health age, are of reproductive age, like from 15 to 49 years old. So it's the third of the 3 million women and girls that are from all Syria. 1 million are refugees. 70,000 refugee pregnant women are in Syria. So that's really, I don't know how to explain it, but it's really something um, like we might not know where to start if we would if we would aim for like healthcare for just the only the pregnant women. They really need urgent care, like they need to be provided with education. They need to be in sanitary places. They need infrastructure. They need, like you said, Carlos, midwives. There aren't the community just is broken now. The like يعني so few of the families are still all together as a family. Not to mention the whole village. So it's really hard for them to meet again or to see each other. They're really scattered all over the globe, let's say. So that's for Syria.
Okay, thank you so much. It is okay. So it was a pleasure. Our time is running up now, so I'm just gonna try to quickly try to wrap it up. Um, well, in Square, we're trying to develop now, let's say, our own stances as medical students and gathering of information, let's say, within SRHR in a humanitarian crisis. So right now, we created the initiative together with Anshuta and Elisa, which who is your regional assistant for the region of the EMR. To create a booklet on SRHR and the humanitarian crisis. So if you're interested, and for all the angels out there, if you guys are interested in joining, please find the call in the Facebook group and email servers, and please join, and we will be very happy to receive your applications. Unfortunately, we need to have a small group of people working on it. But if you're still interested in the topic and passionate about SRHR, I'll definitely ask you to apply. And yeah, I think that's thank you very much, Lujan, for being here. And I'll now hand it in to Shuru.
Thank you, Carlos. So the way that I got introduced this topic was when I started reading up more about what was happening in the world, and 2016 has been quite a roller coaster with with a lot of things happening that go to show that the coming years might not be as easy as they intend to be. Given the same, I think as advocates for SRHR, we need to be equipped for it, we need to be prepared, because the biggest thing about disasters is that you never know when it's coming. The only thing that you can do is be prepared for it. So even though your country or my country might not be having issues regarding SRHR, or might not be having a humanitarian crisis, or might not be having regular disasters, uh, the best thing to do right now would be to stay prepared, because the road ahead is not the easiest. So thank you so much, Carlos, and thank you, Lujan, for joining us today. And I hope you guys like the webinar. And if you guys have any questions, you all can always write to us. Um, or you can send us messages. We're all on the Scora Facebook group as well. Please don't forget to apply for the small working group that's going to make the booklet on this particular issue. And hope to see you soon, probably in one of the future meetings. Have a good day, guys. Bye bye.